We're calling, we are here in headquarters here in South San Francisco. The rest of you are spread all over the state. I'm welcoming you. We're going to consider applications in both clinical and infrastructure program today. I'm going to start the meeting with asking Scott Tosher to call the roll.
Dan Bernal.
Present.
Ray Bonneville.
Present.
Judy Chow. Leandra Clark-Harvey.
Good morning.
Good morning. Anne-Marie Duliege. Isabel Daron. Mark Fisher Colbury.
Here.
Fred Fisher.
Present.
Elena Flowers. David Higgins.
Present.
Vito Imbasciani.
Here.
Rich Lahara.
Present.
Chris Miaskowski.
Present.
Lauren Miller-Rogan.
Here.
Adriana Padilla.
Here.
Joe Panetta. Marv Southard. Carol Watson. Kevin Zhu.
Here.
Great, thanks very much, and we have a quorum.
We do. Thank you, Scott. So we'll start with the consideration of applications that were submitted to our clinical trial stage projects, Clin 1 or Clin 2. I'm going to ask Gil, where are you? There you are. Dr. Gil Sombrano?
Yes. So Haley Lamb is going to be presenting this one.
Thank you. Haley, where are you? Let's see.
I'm here.
There you are.
Give me a moment here to share my slides.
Thank you.
All right, can folks see that?
Perfect.
Excellent, thank you. Good morning, folks. I'm here, as Vito said, to present the clinical application for the committee today. As always, we begin with the mission, accelerating world-class science to deliver transformative regenerative medicine treatments in an equitable manner to a diverse California and world. The clinical budget status is bright, shiny, and new from your approvals last month. The allocation is for the clinical budget is $145.5 million. And today before you is the very first request for this committee of just under 8 million, which we've rounded here to 8 for simplicity's sake, with nothing approved yet. The scientific scoring system for the clinical program, as always, is a score of a 1, 2, or 3. A 1 is a recommendation for funding. May have minor things that can be resolved during contracting and during the course of the award. A score of a 2 is a recommendation from the committee that the application cannot be funded at this time, but has addressable changes or additional clarifications that can allow the application to be resubmitted. A score of a 3 is a do not recommend for funding from the committee, and the application cannot come back for the next 6 months. And again, all the applications are scored by the scientific members of the grants working group without a conflict. They arrive at the score with the scientific review criteria, which are these 5. Does the project hold necessary significance potential for impact? Is the rationale sound? Is the project well planned and designed? Is the project feasible? And does the project uphold principles of diversity, equity, and inclusion? In addition to the scientific scoring, we also in the clinical program have the diversity, equity, inclusion scoring by the board members that sit on the committee. The DEI scoring is on a scale of 0 to 10, 10 being the best as outlined below. And we have our rubric that's posted on the website. Again, here the DEI scoring is similarly scored by all board members with no conflicts. The composition of the grants working group is composed of up to 15 scientific grants working group members that are disease area experts, regulatory, manufacturing, product development, and they provide scientific scores on all applications. We have board members that sit on the panel as well that provide DEI evaluation, the patient perspective on the programs and applications. They provide a DEI score on all applications and are welcome to provide suggested scientific scores as they are interested and comfortable. And in the clinical programs, we also have scientific specialists that are non-voting experts that are brought in to fill in expertise as needed on individual applications. And they provide initial scores, but do not submit final scores that you see before you today. So today for the application under consideration, there is one conflict with the ARS committee. I believe Isabel is not here today, so I think that's all right. So moving on to the application, Clin 2 15901. So this is an autologous BCMA CAR T cells for the treatment of relapsed refractory light chain amyloidosis. And again, as described in the title, this therapy is an autologous BCMA CAR T cells for the indication of the amyloid light chain amyloidosis. The goal is a phase 1b trial completed, and the funds requested are just under 8 million, with over 5 million in co-funding from the applicant organization. This application requires a 40% co-funding, and this is a California applicant. A little bit of background information on this project. So the clinical background on this, the disease is a rare plasma cell disorder where basically the immune system protein, this light chain, is overproduced and accumulates in various organs of the body, namely the most common ones being the heart, the kidneys, or in the peripheral nervous system. So the accumulation of these abnormal proteins builds up slowly over time, and it can lead to multi-organ failure and death in the long term. In the United States, close to 4,000 people are diagnosed every year, and African Americans have a twofold higher rate of occurrence as compared to whites. So the proposed therapy, right now, there's no cures for this disease. The current standard of care is an antibody therapy with chemo, and usually results in progression of the disease over time. The proposed therapy similar targets targets and destroys the abnormal plasma cells, and is intended to be a one-time treatment as opposed to the current standard of care, which is potentially repeat treatments. And how it's relevant to CIRM is that the therapy itself is genetically modified autologous immune cells. In terms of similar CIRM portfolio projects, CIRM currently does not have any active TRAN or clinical awards addressing this indication. And the applicant team does not have any prior CIRM awards. So for your consideration today, the application recommendation from the Grants Working Group was a unanimous recommendation for funding with 14 votes for a score of 1. The DEI score was a score of 7. And the CIRM team is recommending that we fund this application for the total amount of just under 8 million here. And I'll turn it back to the chair. Thank you.
Thank you, Haley, for a great presentation. So we have before us one application for consideration. I'd like to entertain a motion to fund the recommendation to launch the discussion.
Move, Marvin.
Second, Chris.
Thank you, and thank you for self-identifying. Makes it easy for transcribing. So discussion on this application from board members. No, and do we have any member of the public that wants to speak on this?
There are no hands raised.
No hands are raised. Okay, one last call for comments from any board member on this before we proceed to a roll call vote. Okay, thank you, Scott.
So the motion is to fund CLIN 2 15901. Dan Bernal,
Aye.
Ray Bonneville,
Yes.
Leandra Clark Harvey,
Yes.
Mark Fisher Colbury. Sorry, Mark, I'm not hearing you. I'll come back to Mark.
Yes, yes.
Great, thank you, Mark.
Thank you.
Fred Fisher,
Yes.
David Higgins,
Yes.
Vito Bassiani.
Yes.
Rich Lahara,
Yes.
Chris Miaskowski,
Yes.
Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Marv Southard. Marv, sorry, I think you may be on mute.
Yes.
Great, thanks very much. Kevin Zhu,
Yes.
great, thank you very much. The chair,
Okay.
motion carries.
Motion carries. Thank you. Thank you, everyone. Moving to the next agenda item, it's to consider the greater number of applications that have been submitted in response to two infrastructure programs, Infrastructure 6-1 and 6-2. And this time, I won't be mistaken in asking Gil to take over the presentation.
Yes, thank you very much. So good morning, everyone. I'm going to present the outcomes of both Grants Working Group and Facilities Working Group recommendations related to the shared resource laboratories. And so these are going to be related to resubmissions that were made. You may recall that back in February, we reviewed and approved some applications, but this is for revisions, and I'll go through all of that. So again, starting with our mission to accelerate world-class science to deliver transformative regenerative medicine treatments in an equitable manner to a diverse California and world is why we're here, and that is a critical part of this program as well. I'm just going to give you a very brief reminder of what the Shared Resource Labs program intends to do. Its overall purpose is to provide several functions once they are established. It is to provide research locally and regionally, meaning within the institution that provides it, but then also more broadly to neighboring institutions, companies, and other organizations that could benefit in order to have cell culture facilities to conduct stem cell-based modeling experiments and other highly specialized technologies that come from those laboratories, to provide also well-characterized, unmodified, and modified human pluripotent stem cell collections, stem cell-based models, and provide training to those who want to use them on how to use these and the facilities and space to do it. It is also to provide educators a formal techniques course for student education. So a good example of this is for the Bridges program. The Bridges students often utilize the shared laboratory techniques course program as part of their training when they enter a laboratory. We also, as part of this program, want each of them to implement a sustainability plan, and this is important so that these services, once established, can continue even after CIRM has ended the award. We want these to be ongoing programs. A reminder that the program was divided into two different types of shared resource labs. We have the 6.1 establishing SRLs, and these were laboratories that provide an award of 5.4 million and is intended for those that will expand the geographic access to models and can establish and have the capability to establish these in their location and hopefully provide a scientist in the area new opportunities to work with these. So because these are establishing SRLs, we are providing funding to renovate facilities in order for them to establish these labs, as well as equipment and operations funding. And we are not requiring any co-funding. On the other hand, the 6.2 program, which is for enhancing or expansion SRLs, is focused on those programs that already have either an established lab, perhaps that was initially funded by CIRM at some point, or that they have established themselves. It provides 4.3 million for them to develop cutting edge stem cell based modeling expertise. It provides funds for equipment and operations, and there is a required 20% operational co-funding for this program. Overall, for both of these types of SRLs, the program budget is 50 million total that was allocated. The applications for these revisions were reviewed by two different groups. It was the Grants Working Group as well as the Facilities Working Group. So I'll just go very briefly through the composition of both. The Grants Working Group, which you're more familiar with, has 15 scientific members that perform the scientific evaluation of these programs. We also have our 7 board members who participate, patient advocate or nurse members that provide perspective on DEI, significant potential for the projects, and they also provide oversight on the process. For the facilities working group, we have 4 real estate experts that provide their expert evaluation on the facilities components. And again, we have board members who are part of this group, of which we have, again, 7 board members, including the board chair. Both groups use the same scoring system of 1, 2, or 3 to assign merit to these applications, with a score of 1 being exceptional merit and warrant funding. Score of 2 means it needs improvement. Score of 3 that it's sufficiently flawed. And when we went through these revisions, they used the same scoring system that was used initially. The scientific review criteria, this is the basis for the scientific score that was designed by the grants working group, are based on these 5 questions. Does the project offer a significant value proposition? Is it well planned and designed? Is it feasible? If they propose a stem cell techniques course, is this well designed? And does the project uphold the principles of DEI? For the facilities working group, their score was based on these questions. Does the proposed renovation or facility improvement project support the applicant's core research and educational activities? Are the facility improvements feasible as proposed? Does it include the appropriate research equipment and laboratory configuration that supports those activities? Are the renovation facility improvement costs appropriate? And does the applicant ensure DEI goals for the design and construction? Okay, so I'm going to now, with that background, remind you of where we were back in February when we had the initial review. And so the outcome of that initial review led to this, where we had, and I'm going to separate the 6.1 from the 6.2 program. So right now we're looking at a table with just the establishing applications. And so we had 6 of those. And at that time, we had 1 application that had a favorable score by both the grants working group and facilities working group. And so our recommendation was to fund it. And so that has moved forward, is in the process of launching. We had the remainder that had a score of 2, either from the facilities working group or the grants working group. And so those were given the opportunity to revise their applications and resubmit them in the respective areas where they had a 2. The score of 1 that they had is retained for the areas where they did well, but the areas where they needed improvement is where we focused them on their revisions. So we allow them to revise that. For the 6.2 program, we had more applications. We had a total of 20 altogether, and there were 4 that were scoring with a 1, and so those were approved for funding and moved forward. There were 6 that received a score of 2, so those got the opportunity to revise and resubmit, and then there were 4 others that were not funded. All right, so that's where we left off. In terms of the budget, as I mentioned, we started with 50 million as the amount available for the program as a whole. With the 2 tables that I just showed you, we had 1 that was recommended out of the 6.1 establishing group, and there were 4 that were recommended out of the 6.2 expanding enhancing group. So the total from these 2 was 21.3 million. And so that was approved, and we had a balance of 28.6 that would allow support of 6 additional awards. And so let me just summarize where we are in terms of the application status. So following that initial grants working group and facilities working group reviews, we allowed those that received a score of 2 from either group to revise their applications and resubmit. There were 2 applications that were reviewed by the facilities working group and 9 that were reviewed by the grants working group, so a total of 11. And as I mentioned, there would be 6 that out of those 11 that we would be able to fund with the remaining funds. The focus of the reviews by both groups was to evaluate and score the resubmission. So they focused on whether or not the applicants provided the needed clarity, additional information in order to upgrade it to a score of 1 or not. And so we will then go over the outcome of that. So now this is the outcome of the review by the working groups as it relates to the resubmissions. So we're looking here only at the 6.1 program, the 5 applications that had a score of 2 by one or the other group. The first 2 rows show the 2 applications that were reviewed by the facilities working group. One of these received a score of 1, meaning it upgraded from a 2 to a 1. And so our recommendation is to fund that application. There was one that was downgraded to a 3, and so we don't recommend funding for that one. The grants working group looked at 3 of these, and so they had 2 applications that they upgraded to a score of 1, and 1 that was downgraded to a score of 3. And so our recommendation is to fund these 3 of the 6.1 program. Okay, I'm going to show you now the 6.2 applications and the recommendations there. Here for the 6.2 program, there is no facilities working group review. That's not required. They don't have renovations, so that's not relevant. Only the grants working group review was necessary for these. There were 3 applications here as well that upgraded to a score of 1. And there were 3 others that remained at a 2 and did not move forward. Let's see. Okay, so now with regards to the budget, we have out of the 6.1, 3 applications that are recommended. So the total funds requested from these 3 applications is just over 15 million. Out of the 6.2, I showed you 3 applications that upgraded to a score of 1. The total for that one's 11.6 million. The grand total from all 6 is 26.8 million. And if you recall, we had about 28.6 million left. So that by chance, fortunately aligns very well with the budget that was remaining. And so our balance would be only 1.8 million, which is not sufficient to fund any other program. So it's nice when it works that way. So for your consideration of these applications, I want to remind you of some conflicts of interest. And so in this case, because we have a limited number of applications that cannot all be funded, even a conflict with one application would prevent any board member from participating in the discussion of all of them. So these are the board members that have a conflict, so please refrain from participating in the discussion. And I'm just going to go back to this. I don't know if that is helpful to just keep it the slide here, and I will turn it back over to the chair.
Gil, especially for the clarity of the presentation, because for reasons that you very clearly articulated, this is not our normal straightforward consideration of applications. And because of that, board members, in a sense of honoring or humoring the chair, even though this is one agenda item, I'm wondering if it would be better for clarity and for logistical reasons that when you make your motion to fund or not fund, that we sort of break this list of applications in half to consider first the Infrastructure 6-1 applications, of which there are 5. And when we've settled that matter, then to go to Infrastructure 6-2, the enhancing applications. I don't think if we were to do that, it would disadvantage or prejudice one group against the other. Having said
Vito, I think it's 3 applications in 6.1, not 5.
that is a motion from Fred.
No,
I'm sorry.
no,
Did I
Fred,
not hear that?
Fred, you're correct. The total number of applications pending is 5. The total recommended is 3.
Yeah, so moved.
To
Fund
fund
6.1.
To fund the 3 applications in 6.1. We have a motion from Fred.
In seconds.
Marv has seconded it.
Marv is second. Okay.
Can I ask, is it the additional part of the motion to not fund the remaining applications? In 6.1?
I guess that's to
The
Fred
motion
then.
is to fund the applications that were recommended for funding.
Okay, we can take up a second motion. I was just,
Thank you. Let's do that then. The motion on the floor is to fund 3 Infrastructure 6.1 applications. 15363, 15413, 15517. Discussion on these 3 applications from board members. Hearing no discussion, is there any member of the public who would like to comment?
There are no hands raised.
There are no hands raised. I think we can proceed to a vote, Scott.
for members Bonneville, Clark Harvey, and Fisher Colbury, if when you respond, if you could indicate either aye or nay, except with respect to those applications with which you have a conflict. Or words to that effect. Dan Bernal,
Aye.
Maria Bonneville,
Yes, except for those with which I have a conflict.
Leandra Clark Harvey,
Yes, except those in which I have a conflict.
Anne Marie DeLiege,
Yes.
Mark Fisher Colbury.
Yes, except for those which I have a conflict.
Thank you. Fred Fisher,
Yes.
David Higgins,
Yes.
Vito Imbasciani,
Yes.
Rich Lahara.
Yes.
Thank you, Rich. Chris Miaskowski,
Yes.
Lauren Miller-Rogan,
Yes.
Adriana Padilla,
Yes.
Marv Southard. Sorry, Marv.
Yes.
Thank you. Kevin Jew.
Yes.
Thank you, Kevin. And that motion carries.
Great. Now, we need to complete this section. I need a motion from a board member not to fund the 2 other applications in this category. And that would be application Infrastructure 6.1, 15366 and 15478.
I move. Anne-Marie, I move.
Motion from Anne Marie, thank you. And a second?
Fred Fisher,
In
second.
seconds.
Thank you. Any discussion on these 2 applications? And if not from board members, any member of the public wishing to speak?
There is 2
Two.
hands raised.
Okay.
Okay, sorry. So the first one will be Jurdica, I'm so sorry about this, I do not know how to pronounce your name. Last name Koss. After that will be Isabella Bagdasarian. So I think Dr. Koss, you will have 3 minutes. We will keep time. And the clock will also appear on your side of the Zoom screen. You may start now.
Yeah, good morning. I would like to discuss application 15366. I am Georgita Koss. I am Associate Vice Chancellor for Research and Economic Development at UC Riverside, and thank you for this opportunity. Our proposal, Bioform, was not recommended for funding, and we hope that you will review our proposal strengths and will reconsider it in light of our regional needs. Without this funding, the residents of Southern California Inland Empire will be deprived of the up-to-date stem cell training required for workforce development and scientific innovation in our very diverse region. Please consider the following 3 interrelated points. First, UCR's current core is a regional hub for dissemination of cutting-edge methodologies. Our scientific proposal received a Tier 1 ranking. Bioform would enable UCR to offer training program that brings organoid cultures, 3D printing, and 9 stem cell mini certificate courses to laboratories in the Inland Empire. These courses would prepare the region for the next generation of stem cell research and increase our workforce development. Second, UCR integrates DEI efforts into the work of innovative science. As the region's only stem cell core, UCR is vital to the project of ensuring the DEI efforts are primary component of stem cell training. UCR stem cell programs have educated numerous students who would otherwise be underserved. Bioform would expand the core's workforce development capabilities and increase the support it provides to the many of our regional partner institutions. Third, Bioform would contribute to the foundation of future scientific innovation. Bioform's infrastructure would expand the scope of the extramural funding for which UCR could apply, and this would have additional effects on both scientific innovation and DEI training. By contrast, without this funding, UCR stem cell core may need to close, meaning that the region would lose a vital innovation and training hub. If certain funding does become available, UCR's team is fully capable of renovating and sustaining this project. This is demonstrated by the excellent construction of our current stem cell core.
Thank you so much, Professor Koss. The time is up. The next speaker will be Isabella Bagdasarian. You'll have 3 minutes. The clock should appear on the top right of your Zoom screen.
Hello, thank you for allowing me to speak today on Application 15366. I am here to urge you to consider funding the establishment of the Shared Research and Training Facility at UC Riverside. I'm a bioengineering PhD candidate at UC Riverside, and I am fortunate enough to be funded through the CIRM Scholars Program for graduate students. With this funding, I have been working towards engineering a 3D muscle model from pluripotent stem cells. My research in the organoid field has provided me with an appreciation for how involved developing 3D stem cell-based models can be. Techniques that may be simple in 2D culture present new and unique challenges in complex engineered tissues. The establishment of the Bioform core at UC Riverside will help to alleviate these challenges while training the next generation of scientists and engineers. The Bioform core would expand an existing successful stem cell research center that's previously been funded by CIRM by bringing crucial instrumentation like bioprinting to the underserved Inland Empire region. Currently, the nearest bioprinter is 60 miles away through Southern California traffic. This is a major barrier to UC Riverside and the 5 other Inland Empire universities who rely on the stem cell core. The Inland Empire is geographically isolated and historically underserved, economically, educationally, and medically. Rapid establishment of the Bioform Core is critical if we wish to empower disadvantaged students and researchers in the Inland Empire. The proposed Bioform program will extend the region's stem cell expertise to include creating complex stem cell-based 3D models of organoids, tissues, and organs for regenerative therapies. These approaches represent the forefront of stem cell research and are a complementary blend of basic stem cell biology and bioengineering. As a lifelong resident of the Inland Empire, I have continuously witnessed the university expand and innovate. Most importantly, though, the Stem Cell Core has remained an essential resource in recruiting and training scientists from historically underrepresented communities. The Bioform Core will expand on this progress by providing a diverse group of researchers from the economically depressed Inland Empire with the platforms needed for advanced 3D organ engineering. Through working with the Inland Empire students from the STEM Spark program through Bridges, I have observed that they often do not have robust access to the instrumentation needed for 3D culture models at their home campuses. Expediting the formation of the Bioform Core is vital to empowering this diverse group of researchers. The Bioform Core training program addresses a critically unmet need for the Inland Empire, ultimately reducing the barriers to entry for scientists at every education level who wish to develop 3D models of organoids, tissues, and organs. I implore you to consider funding the Bioform Core and help to establish the Inland Empire region as one of scientific innovation. Thank you.
If there are no other comments from board members or the members of the public, we'll proceed to a vote on the second motion here.
Great, thank you.
I'm sorry, because it's hard for me to manage from far away. I don't have a comment, but of course I'm going to ask, this is Anne-Marie, Gil, if you can respond to the two comments that were just made about the UC Riverside program and provide your perspective on this.
Okay, I will do my best to do so. I mean, I think the points brought up by the members that relate to the Inland Empire and the need to establish and maintain a presence there, I think is important. We did support a shared lab in the past that has continued to exist without our funding, because we did actually stop the shared lab funding several years ago. So we're glad to know that it has continued despite not having had continued funding from us. I mean, the only other thing I can say is that, you know, this program was reviewed by the facilities working group, because that's the area where they needed improvement. Unfortunately, the facilities working group was quite disappointed with the proposal. They felt there was a lot of elements that were missing in the application that would allow them to feel comfortable moving forward with this. They felt that, you know, the timeline and a lot of the elements that would give them some level of comfort that they could do this was not really there. So I think both the facilities working group and the grants working group did strive to look at these applications from the perspective of these are areas that are underserved and would greatly benefit from having these laboratories established or continue to function here. So that is certainly something that we agree with, and I think the working groups agreed with. But I think when it comes down to looking then at the application and the substance of those applications is where they found that they were lacking and did not feel comfortable moving forward with it. So
a quick response. I know I've seen Martin with your hands up. Thank you, Gil. As always, your response is very informative. On one hand, you know how I'm always following the recommendations of the various working groups, but when two people come and want to explain why they have a different perspective on it, it's worth having your perspective. So then my question is, if they were to reapply, do they have a chance to reapply and provide a better proposal than the one that they did? And in which case they could be reconsidered? Or is so far our no is a final no for this?
Yeah, unfortunately, at least for now, it would be a final no, because we would be utilizing up our budget. And there is no plan at the moment to have another edition of the shared lab program emerge. It doesn't mean it can't or that it wouldn't, but at least at this time, we don't have any plans specifically to establish additional laboratories.
Thank you very much.
And
over from you.
I just wanted to add that the reason it went from a 1 to a 3 is not because the proposal was terrible, but because there was no money left. So there was no sense in giving them a 2 to resubmit and waste time for no money.
Thank you.
I think we have another member of the public, if I'm not mistaken, a new member.
Yes, Professor Martin Garcia Castro, you have 3 minutes.
Thank you very much. I really appreciate the opportunity. I just want to make 2 quick points. First of all, I think that it's clear that our application received top scores from the Scientific Review Board, acknowledging the value of it. And one of the 5 criteria that was used is feasibility and design. And that received a perfect score with 14 out of 14 votes. The second point that I want to make is that while I agree with the outcome of the facilities review that gave us a 3 score, I just want to acknowledge that our university appears to not have the same resources to provide the application that would have seen with better eyes. We tried, we did our best to answer the request, and we cannot compete. And I want you to appreciate the difficulties to convey our mission of equity from CERM or from the government of California when we don't recognize the flaws in the system that will play against those that have less resources. I think we've done a great job scientifically as recognized by that score. And when we think that our application could have been better had we had more resources to put into it to provide all the details that were necessary, perhaps this application we have seen with better eyes. And because of that, I make the same pledge that the other 2 people, and I ask one of the committee members to rescue and reevaluate the value that this proposal has for the region, for its scientific merit, and for the contribution that we do to CERM and to the government of California. Thank you very much.
Thank you, Professor. I'm going to ask Scott to proceed to a roll call vote.
Okay, this is not to fund the remaining 2 applications, 15366 and 15478. Again, the same request of members Bonneville, Clark Harvey, and Fisher Colbury. Dan Bernal?
Aye.
Maria Bonneville?
Yes, except for those with which I have a conflict.
Leandra Clark Harvey?
Yes, except for those for which I have a conflict.
Anne-Marie Deliege?
Yes.
Mark Fisher Colbury?
Yes, except for those for which I have a conflict.
Thank you. Fred Fisher?
Yes.
David Higgins?
Yes.
Vito Imbassiani?
Yes.
Rich Lahara?
Yes.
Chris Miskowski?
Yes.
Lauren Miller Rogan? Lauren? I'll come back. Adriana Padilla?
Yes.
Marv Southard?
Yes.
Kevin Zhu?
Yes.
And I'm just coming back to Lauren Miller Rogan. Stand by, we may have enough votes, just let me count here.
She did just that.
Great, we do.
We do have enough.
The
Okay.
motion carries.
All right, the motion has carried. Thank you. So I'd like now to move to the 6 applications that are in the infrastructure 6-2. These are proposals to enhance or expand existing laboratories. I would like a motion, a single motion this time. It might be more expeditious to fund the 3 that were recommended and not to fund the 3 that were not recommended.
So moved, Fred Fisher.
And I second, Anne Marie.
Thank you, Fred, and Marie. Anne Marie, thank you. The floor is open to discussion on these applications from board members.
Anne Marie has her hand raised.
Anne Marie, you're the first.
Yeah, in fact, it was a follow-up to our previous discussion. Each time members of applications, our colleagues who've applied such as the 3 we just heard, I really want to add my perspective as a board member, because I can sense the disappointment, and particularly in this case when they have done an effort over the years and they see that because of lack of funding, this effort is going to be either coming to a slowing down, maybe unless they find their own source of funding. And we all know that these days it's particularly difficult to find your own source of funding, except for the CERM. But I hope that you've understood that it's really a matter of how much money we have here. In fact, it is not a reflection on the quality of the work done in the past and proposed in the future. We are looking very carefully of how we spend the CERM money. That's our responsibility, to make sure that it can last for the duration we have, and we have to make some choices here. These are hard choices, not so much for us to make, really. Important for us to make, but the most difficult is for you as a consequences of our choices. So I stand by our choices, but I want to express my compassion in some way for the challenges that you will now face. Over.
Thank you, Anne Marie. I'm going to proceed with comments from other board members. Fred Fisher, you're next.
Yeah, I want to take exception to what Anne Marie just said in terms of characterizing the rejection of the proposals strictly due to funding, which I think might have been propelled by a comment by Mars Southard. I was on those review committees, and the work of the specialists on those committees is of the highest standard. And those people failed those proposals, not because there wasn't enough money to fund them, but because they were they went from being flawed to being more flawed. So it wasn't just a matter of funding. It was a careful review of the proposal and the extent to which the applicants did not address the comments that were provided as following the first round of evaluations. So as someone who sits on many of these committees, I just wanted to share the perspective that my experience of these proposals, specifically the last 2 that Anne Marie was commenting about, it was not about the lack of funding. It was about the lack of improvement and in fact, some backtracking that resulted in the lower score.
Thanks, Fred. I don't see any other board members raising their hand. We'll proceed to comments from members of the public. Claudette?
We have 2 hands raised. We'll start with Dr. Willard and then Dr. Snyder. Dr. Willard, you have 3 minutes.
Hello, dear members of the Application Review Subcommittee. My name is Carl Willard. I'm a professor at the University of California, San Diego, and I'm the PI on the infrastructure grant 6.2 15416, which unfortunately scored as Tier 2 and hence has not been recommended for funding. While this is quite disappointing to us, we very much respect the decision reached by the Grants Working Group. However, I would like to make one last request to this board regarding our application. Although the proposed shared resource lab was deemed not a significant value proposition, the proposed stem cell techniques course was viewed as well-designed, receiving 10 out of 11 positive reviews. I'm here to request that this portion, the educational and training component of our grant application, receive the proposed funding of $1.3 million. Aside from it receiving highly favorable reviews and comments, I'd also like to highlight that this proposed techniques course is a joint effort with our neighbor, the Sanford Burnham Prebys Medical Discovery Institute. My colleague, Professor Evan Snyder, who is at this institute, has worked with us at UCSD to coordinate and integrate our respective teaching and training resources and expertise and offer a comprehensive and unique curriculum that will benefit researchers in San Diego and across the state of California. It should be noted that with the currently awarded grants, there's no such comprehensive techniques course in San Diego, despite its high density of academic institutes and biotech industry that would stand to benefit from this valuable resource. I therefore respectfully ask you to consider awarding us the funding proposed for the techniques course portion of our grant. Thank you very much for your time and your valuable service to the stem cell community.
Thank you, Professor.
Thank you so much, Dr. Willard. Dr. Snyder?
Great, thank you. I also would like to please speak on behalf of UCSD's application, but make an unusual and somewhat creative request of the ICOC to please contemplate. As Carl mentioned, we on the Mesa consolidated a very comprehensive course that included both basic and advanced techniques via hands-on and didactic instruction. And it's pivotal to the UCSD application. As Carl mentioned, it was ranked Tier 1 by 10 of 11 reviewers, called the strength of the proposal, and said to merit funding. It was praised for its three components, a 2-week, 3 times a year boot camp-like basic course led by Jean Loring and Suzanne Peters, who actually published the lab manual from which the syllabus was obtained, and also have taught many of these courses. A 10-week lecture course, which puts all of the techniques in broader perspective, and then small mini courses for sophisticated deep dive, which was also termed to be quite unique. There was also a major emphasis on clinical correlation and individualized curriculum. But I think the most appealing and unique part of this that I'm hoping that the ICOC will pay attention to is that we configured the budget and the tuition to be able to give at least 5 travel and tuition awards every year, even more if revenue exceeded costs, to underserved and under-resourced communities. We documented in our DEI statement how we would reach out to these communities. CERM trainees would obviously get tuition-free training, but then would become teaching assistants and mentors, learning to mentor, getting a stipend. And regional community universities and colleges have indicated in their letters of support how they would send students to this course to be able to get college credit for tasks and skills they cannot impart. Sustainability was not only by tuition, but by corporate sponsorship. There's a stem cell alumni group. Our goal is to get the next generation into the pipeline to be able to take advantage of cutting edge techniques. There is no such course south of LA to my knowledge, certainly not in San Diego. And I'm simply asking whether the unused portion of the allocated budget, which exactly matches the needs of this course, could be creatively used for this course, which can serve the entire state of California in a way that is not.
Thank you so much, Dr. Snyder. Your time is up. We do have one more member of the public that wants to speak. Catherine Leha, you have 3 minutes.
Thank you. Dear Sir members of the Application Review Subcommittee, thank you for your valuable time today and efforts towards excelling stem cell research in California. Congratulations to the selected applicants, wishing you all the best success. It is an honor to be considered amongst such novel scientific experts. My name is Catherine Leha from the University of California, San Diego, representing Dr. Carl Willard's Infrastructure 6.2 15416 application. I'm speaking to humbly request the remaining 1.8 million available budget be granted to our core facility operations and technique course offerings. 1.3 million towards technique course, 500K towards operations and or equipment. We will continue to provide the additional 650K from internal support, which includes the 20% co-funding and operational costs, totaling 2.45 million in funds towards education outreach and research offerings. I want to express my gratitude to the reviewer comments and questions. We appreciate your positive words on the proposed project and respected feedback. Our goal is to implement the stem cell course offerings and purchase the most valuable piece of equipment that focuses on stem cell biology over additional cell sorters. If equipment is not acceptable, I kindly request funds be allocated towards the hefty service contracts, which are on average $125,000 a year. We currently participate with several CIRM-funded programs such as CIRM Bridges, CIRM Education for Training Grant, CIRM Spark Program, to name a few. These channels increase the presence of CIRM at the Stanford Consortium for Regenerative Medicine. The building houses 35 plus leading scientific faculty members and hundreds of project scientists, students, postdoctoral fellows, visiting scholars, and interns specializing in infinite discovery. I help to oversee the finances and operations of this core and 2 others in our building, along with dozens of programmatic events and educational outreach. I speak with confidence to gain your vote and assure each one of you here today that we are the best asset to invest in. I hope to convince each of you in our competence to produce novel stem cell-based modeling techniques and scientific findings towards life-saving regenerative medicines and therapies that will transform the research world. We are happy to resubmit the application with a revised budget and proposed and project proposal if applicable. Happy to take any questions in our meetings to discuss the endless opportunities of working towards prosperity. With the gracious initial funding from CIRM, this core and the building was brought to life. We wish to manifest a future of continuous growth with our founders. Your valuable support and time are greatly appreciated. Thank you and have a wonderful day.
Thank you so much, Catherine. That is it for public comment.
Okay. Any final comments from board members? Okay, we're going to proceed to a vote. Once again, this is a vote to fund 3 applications and not to fund 3. Do I need to state the application numbers?
No, I think it's fine to just say that to accept the CIRM team recommendations regarding funding.
That's it.
Yes. I'm sorry, Anne Marie?
Oh, you are.
Anne Marie, I believe you're on mute.
Anne Marie, you're muted. Anne Marie, can you start again?
Yeah, it's, I'm in a car in England and trying to manage on my cell phone all of this. So in regards to the comments that were made, I would like if any of you, Maria, Vito, or JT, could comment on how realistic, relevant, and acceptable are the proposals that were just made by the people who just intervened. Thank you.
So Maria Bonneville cannot comment because she has a conflict with regard to at least one application in the bunch. I can just say if I could leap to the head of the line, and Marie, from a process standpoint, of course, the Application Review Subcommittee is tasked with following the concept plan that was adopted by the board and the terms that are endorsed by the board when it adopts a concept plan that is then generates the ensuing RFA. So at least for our purposes today, it's not feasible for the committee to sort of reimagine how the RFA might be changed today. So I just wanted from a process standpoint to make that comment. I don't know if JT or Vito or others have any other opinions.
JT, would you like to take a stab at it?
Yeah, Anne Marie, I completely agree with Scott. We have a vote here on the items that are in front of us and are not capable at this time of addressing these suggestions as they are outside the scope of what is before us.
Yeah,
Very clear. Thank you.
and I agree also. Irrespective of the budgetary constraint, this meeting today is not the forum to consider an amendment, not to the motion on the floor, but to the whole underlying concept plan that was approved by the board. But I'm sure it will be a topic of ongoing discussion. So.
Thank you very much. Appreciate the
ma'am.
response
Thank
and
you,
the
Emery.
clarifications.
Drive on the right side of the road.
Yeah, a challenge.
All right, I'll proceed with the roll call. Dan Bernal.
Aye.
Thank you, Dan. And just a process point, let me remind just Maria Bonneville and Mark Fisher Colbury of that additional language when you indicate your vote. Maria Bonneville,
Yes, except for those with which I have a conflict.
Leandra Clark Harvey,
Yes.
Anne Marie Deliege,
Yes.
Mark Fisher Colbury.
Yes, except for those with which I have a conflict.
Thank you. Fred Fisher,
Yes.
David Higgins. I believe I heard a yes. Thank you, David. Vito
Yes.
Marcioni,
Yes.
Rich Lahara,
Yes.
Christine Escalante,
Yes.
Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Marv Southard,
Yes.
and Kevin Zhu.
Yes.
Thanks very much, members. The motion carries.
Motion carries. This is the time in the meeting for any general comments from the public on anything we've discussed today or on any item that was not on the agenda.
Don't see any hands.
And not hearing any, I'm going to thank all the board members wherever you are for participating today. And a special thanks to Haley and Gil for their wonderful presentations that helped us through this. Thank you all. The meeting is adjourned.